Dr. Stewart, thanks very much for joining us today. Talking about a problem that when you hear plantar fasciitis, you sometimes think, oh, that's something athletes get, but that's not true. Many people can suffer from this foot problem. What is it specifically?
That's correct. Well, plantar fasciitis is one of the most common causes of foot pain that we see with adults. It accounts for 10 or 15% of all foot problems for adults 40 to 60 years of age. And it really boils down to inflammation of the plantar fascia on the undersurface of the foot, which is a thick fibrous band of tissue that starts at the heel and then fans out toward the toes. It forms the basis of the arch of your foot, which is a key component of your gait and stance.
If you're born with an arch that's too high, or if you're born with what we think of more of a flat foot, that can make a person predisposed to this. Is that correct?
Absolutely. You know, the flat-footedness is one of the more common things we see. That's actually a congenital issue from birth, and that predisposes the person to having issues with inflammation of the plantar fascia. But a high arch can do it as well, because both conditions are at the extremes and can put undue stress across the tissue.
Is the plantar fascia a muscle? Is it a tendon? What is it in your foot?
It's a connective tissue that runs from the heel down to the toes and just forms the floor or the surface of the arch of the foot that allows it to be supported during walking.
Is the pain isolated to the bottom of your foot, or can it cause pain up your legs if it's not correct?
Well, primarily the pain is really at the heel, what's called the inferior heel, where the plantar fascia originates. That sometimes can actually go down into the foot itself, but rarely does it go up into the leg or the ankle itself.
What about people that might be carrying a little more weight than they should? Can that also contribute to this problem?
Yeah, there are a lot of factors that contribute to it. Obesity is certainly one of the main ones that can contribute because of the extra pressure and stress across the plantar fascia itself.
I'm going to assume that surgery might be a last resort, so let's save that till last. If someone comes to you with a moderate case and it's the first time they've dealt with it, what kind of protocol do you begin with to try to treat them?
Well, the vast majority of treatment is conservative, usually consisting of ice, anti-inflammatory medications such as ibuprofen or naproxen, and stretching. Those are kind of the three primary modalities of treatment. Stretching primarily of the plantar fascia itself, and then also the calf muscles. But we also sometimes use orthotics or inserts into the shoe, which can be either a heel cup or a full orthotic to cover the length of the foot.
I had a doctor send me to get orthotics one time. Describe that. Is that something you do, or do you send people to a specialist that's kind of what they do?
Well, there's two varieties. There are over-the-counter varieties of orthotics that most people are familiar with, but you also can do custom orthotics, and that usually requires referral to a specialist to have those created for you.
If you've dealt with this pain and this issue, might you treat it with orthotics, some mild medication or something, get through it and never have another problem? Or once you deal with this, is it something you may deal with once in a while if you overuse it and that sort of thing?
Most people, once they have it, you know, they tend to get over it over time. Sometimes it can last for months on end. You are at risk to have a recurrence of it because of the mechanical issues that contributed to begin with, especially when you couple it with overuse.
Does any kind of an exercise help? A bending or stretching or a ball on your foot? Anything you could think of that would help? Does anything work?
Stretching is probably one of the better things you can do for prevention. Stretching your heel cord, so your Achilles, with a towel or a band, and also just stretching your big toe to stretch the plantar fascia itself can actually reduce your risk. Is
surgery called for if there's an actual tear and it just doesn't seem to be getting any better? Is that, as I indicated earlier or guessed earlier, that would be a last resort?
It's typically the end game for it. You've usually failed most everything else and continue to have significant pain and disability from it. And the surgery consists of actually releasing the plantar fascia, so you actually in effect create a tear by doing the release to take the tension off of the tissue so that you don't have the pain.
I'll make this my last question. I know good doctors like good preventive medicine. Is there something, maybe young people or someone who's never experienced this problem, could they do something like maybe get inserts or something before they ever have a problem? Can they be tested to see if they may be have the potential for this issue?
Well, certainly if you have the mechanical predisposition to have it, such as the flat-footedness or the high arch, then wearing an orthotic to help prevent it from becoming an issue is reasonable. And then maintaining your flexibility, and then of course, as always, we recommend maintaining a healthy weight and a healthy lifestyle so that you can prevent all illness and injury.
Very good. Thank you for your guidance on this, and I hope we can help people that might deal with plantar fasciitis. Thank you so much. Appreciate it.